All right, we are recording, so welcome back to Lifting and Moving Patients, Part 2. So as far as equipment we could use what we call backboards, also known as longboards. There are different types of longboard or a little bit backboards. The most common we use is that longboard, but we just refer to it as a backboard. Then you have short boards, usually made out of wood. Not very comfortable, but they still do the job. The other one is that vest type immobilizer or extrication device. The most common one out there is the Kendrick extrication device, or we just call it a KED or a KED. And there are some, I haven't seen them, but they do have full body vacuum mattresses. And I'll show you a picture of that. So there's the longboard. These are radiolucent. In other words, x-rays will go right through them except for the metal parts that's in them. It's a lot different. They used to use wooden backboards. And I have used a wooden backboard, and it was freaking heavy. Then you put the patient on there, that makes it even tougher. So they do have a lot of uses.
I can use the full body back.
Really?
Yeah. One of the old service that I worked at in Tier C had them.
Okay. I guess Tier C has them. That's interesting. Everywhere I've been, we didn't use those. But hey, they have different type of things. So here's a KED or KD. As you see, it looks like a vest. There's padding on there. These are used when the patient is in the vehicle. So you want to secure them, and then you could worry about getting them out of the vehicle. There is a way to use this. So we will go over that when we get to spinal injuries and trauma months from now. All right. And here's that vacuum splint, which they basically kind of mold it around the patient, and then they take out the air. So it molds around the patient, and it takes care of the voids, gaps where the patient can move. Really the goal of immobilizing the patient like this with any of these longboards is to secure the pivot points. We don't want the patient to move their spine. So the pivot points would be obviously the neck, the shoulders, the waist, and the knees. So if we could secure those points, it will make it a lot easier. Scoop stretcher. These are good for patients with pelvic injuries, hip injuries, because you literally scoop a patient up without having to roll them on their side, because it could be very painful for the patient. So we scoop them up. Not recommended for patients with spinal injuries because it really is not protecting the spine because there's a curvature to them. So here's one type of scoop stretcher. So you separate the ends, and I'll show you a video on them, although they're not very good. You separate the ends in the middle, and you literally just put it together, and it where it says furno, that's actually angled. So that's why you just put it in, and it scoops the patient up. So it works pretty good. Then you have a Stokes basket, or a basket stretcher. I call it a Stokes basket. This is what we should have used to get that dude up, but we didn't have one. Rescue squads usually have this, or rescue trucks will have this. They're pretty good for like high angle rescue, low angle rescue, water rescue. We actually, and this is the plastic one. They also call this one, no, the metal one could be like the kind of a casket thing. I remember we had a guy on top of a roof. I was on the ambulance where I was working as an EMT. And they had a guy on top of a roof of a commercial building. So it's up pretty high. And he was having some heart issues, and there was no way to get him down other than with getting the ladder truck out there. And so what they did was they put the patient on the not scoop stretcher, a Stokes basket, and then they got the ladder over, brought down the rope, hooked it up to the Stokes basket, lifted it up, moved it over, dropped it on top of our gurney, and we transported the patient still on the Stokes basket. And then we took him to the hospital and we transferred him over that way. So that's a pretty cool operation. This is the metal one I was talking about. So a lot of rescue squads have this stuff. And it's a lot easier, although you see it's a 4-point carry, but it makes it a lot easier. Flexible stretcher. This one they're calling it Reeves. One of the good things for this is you see the handles, there's 6 handles on them. So you just put the patient on there, each person grabs a handle, and you're able to carry them that way. A lot of times, and they're a lot bigger with the handles, or I'm sorry, they're a lot wider. They still have the 6 handles, but they're really well made, extra stitching and everything. Used to carry really overweight people. Morbidly. Was that?
The men's section?
Is that what they call it?
Yeah, that's what we call it.
Okay. Yeah, I can see why. I've never used one. I've seen pictures of it, but they have used them for bariatric patients. All right. Questions? All right. So when we're placing patients on our gurney, the most common positions are supine and semi-Fowlers. Later on, we'll talk about if they need to be put in a different position, like a lateral recumbent position. But for the most part, we're going to put them supine or semi-Fowlers. Sometimes high Fowlers. The other thing too is we want to put them in the best position, or what we call position of comfort. How's the patient feel more comfortable? Usually if they're in a lot of pain, abdominal pain, they'll be in the fetal position. They'll be on their side. They drop their legs towards their abdomen because they're in a lot of pain. Their abdomen hurts that much. If they've suffered a stroke, we want to put them on the affected side. So they'll be in the lateral recumbent position. If they're having a stroke on the left side, we'll put them on the left lateral recumbent. If they have the stroke on the right side, we'll put them on the right lateral recumbent. If they're pregnant, we're going to put them on the left lateral. Now, we used to, and it really has changed, one, because of safety issues, but we used to put the babies and even toddlers in mom's lap. Now, before anybody gets mad at me, in my 22 years of doing this, the majority of the time, the primary caretaker is the mom. And the kids I've seen on screen, who's taking care of them? Mom. All right, ladies? Dads are probably sleeping or trying to go to bed, right? Damn dads. Damn men. Or there's other things going on. I just gotta pick on guys sometimes. So anyway, so that's why I say put them on mom's lap. All right, it's not meant to be a sexist comment. It's the truth. Anyway, so we would secure mom to the gurney, and then we'd put the baby in mom's arms. So if anything happens, what's going to happen to mom? Nothing. She's secured. What happens to the baby? Superman, right? Or Supergirl flying through the air. Do you see the safety issue? If they were bad, critical, then we would put the baby flat on the gurney so we could work on the kid. Gotten away from that. A, use their car seat, or B, what a lot of, it's here in El Paso County, they have portable car seats, but they're more like, how do you call it? It's a piece of cloth that has seat belts to it. And you lift up the back and it's a makeshift car seat. You've converted the gurney into a car seat. So, where did he go? Where's Mr. Gabriel? Oh, there you are. You're hiding from me. I see you're hiding behind Vanessa. Do you guys have those? Or you seen Life use them?
I've seen Life use them, but we don't have them.
Okay. What do you know what it's called? I forget.
I've just always known it as the makeshift car seat.
Yeah.
Normally the car seats aren't damaged bad enough that they use the one that the infant's already in.
With car seats, you want to make sure that the child fits securely in there. In case they don't, they've been involved in a car accident. Then you put padding around the baby, kind of horseshoe. Get some sheets or towels, roll them up, and just horseshoe it around the baby. Okay. Scary story. That little kid freaked the hell out of me. We respond to a traffic accident. Mom's all shaken up because she has her baby in there. Kid's like 2-3 years old, right? And so I want to assess the kid. I got my firefighters assessing the mom. I'm going to go check on the kid. And I'm trying to wake this kid up, and he doesn't wake up. Remember those blank moments? That was one of those. So I'm like, let's get a helicopter over here. Because this kid is not waking up. And I'm doing painful stimulus. I'm like, wake up, and pinching and everything. Nothing. So I freaking got something to cut the belts on that car seat to get the car seat out and then get him out of there to get him ready for flight. And then kind of like you've seen the movies where there's all this commotion going on around the person, and then they wake up and they're like, what's going on, right? All nonchalant like. That's how this kid was. I'm like, you're really gonna need that helicopter now. Just kidding, I don't beat up kids. He scared me. He seriously scared me. And then he wakes up like nothing. I assessed him. Everything was fine. So it's been a while since I told that story, but it's what happens. Now, as far as packaging patients for air transport, it all depends on where you work. Most of the packaging is done by the air crew because they know their equipment. They know their helicopter. Now, there's a different type of packaging a patient. And again, that's usually done by the medic. And I've seen this done. We did it in training and we did it in real life. And that was packaging a patient for transport via the helicopter, where they did a pickoff. And I remember we had a guy, and it's always good when it starts out, this guy was drinking, and that's exactly what this guy was doing. And he was riding an ATV. Well, because he was drunk, he went off the road. The road was up or elevated from where the houses were, And so he went off the side and he Evil Knieveled and he couldn't get over the, I think he got over one pile of wood, but then he didn't make it past the second and landed up on top. Flip. So he landed on the wood and he was unresponsive. Now, again, is he unresponsive because of the alcohol or because of a head injury? It was rough terrain getting out there. So imagine putting him on an ambulance over rough terrain. Wait. It's not coming out very well. Sorry. My background. And so we called the helicopter in. So they landed, medic got out, took his, what they call a Bowman bag. And they're going to fly him out. Well, instead of us packaging him and taking him in the helicopter, they're like, all right, we're going to pick him off. And so the medic put him on the Bowman bag, the helicopter lifted off, circled around, and as it was coming, it was dropping its hoist. And then it hovered maybe 100, 150 feet above us, if that. Oh, about 100 feet. Has anybody ever been under the rotor wash of a helicopter? Have you ever found dirt in places you didn't know dirt can get into?
Yep. Oh yeah.
Yeah, I found that out too. Wasn't pleasant. That rotor wash was something else. So they tied in, medic attached himself, and then the helicopter starts to go. So it's kind of cool seeing the patient and the medic dangling from beneath this helicopter. And then as it's going, it's hoisting the medic and the patient up into the helicopter. And they went to the trauma center. So be careful with that rotor wash. And even further away, it's kicking up a lot of dirt, a lot of dust. So wear eye protection. If you ever have to load into a helicopter, what we call a hot load, where the rotor's still going. And we'll talk about this at the end of the book, one of the last chapters, is just be careful with that rotor. And listening to the flight crew. Don't approach the helicopter until you're told to do so. Okay. All right. We've spoken about that. Two-person. That four-person carry is what we call a 4-point carry. Each person gets a corner. You do want to have one person speaking for everybody. If everybody's talking, it makes it confusing. So one person should be talking. Whoever it is, you guys decide. But make sure everyone's in agreement. Even though there's less weight on each person, still somebody can get hurt. I was mentioning earlier about the backboard and taking the patient up the stairs. Remember, you want to keep the patient even with the ground, or not even with the ground, parallel to the ground the entire time. You don't want to tilt it down because the patient then is going to feel uneasy and they're going to want to grab on to stabilize themselves, and that could spell trouble. Elite Ambulance has a contract at Providence. I think they even have it at Children's, where they might take an isolette. It's for newborns that need specialized care. So they'll take the isolette for the transport. They pump in compressed air, and they have other equipment on it to monitor the baby while they take them from one hospital to the other. Was it you guys that was telling me, or maybe it was my morning class? I forget whose child it was or whose newborn, but Del Sol doesn't have a pediatric wing. And so they had to take the baby from Del Sol to Providence. And so they had to call in the medical team and the neonatal transport unit to transport that newborn from Del Sol to Providence. So, all right. So now, rescue engine with a crew of 4 arrived to assist Ricardo and Marisol. Period. The team log rolled the patient and then secured him to a longboard. The stairs were narrow and difficult to navigate. Remember we talked about that? But the 4 firefighters, 2 at each end, were able to carry the patient up the stairs with Ricardo and Marisol acting as spotters. Damn, you guys make them do the work. Good job. Damn, hose jockeys. I'm surprised they got him to do the work. I was Marisol being sweet. That's why they did the work. Way to go, Marisol. Where'd you go? Oh,
I'm
there
here.
you are. There you are. See, way to make them work. Get them off their lazy boys. All right. So once they were at the top of the stairs, the firefighters played. Man, again, doing all the work. Good job. They placed the patient on a wheeled stretcher and secured him to it for transfer to the ambulance. Ricardo continued care on the way to the hospital, while Marisol notified the receiving facility that they would require lifting assistance on arrival. So, be very safe when lifting and moving patients. There are a lot of hazards. There are a lot of ways to injure yourself. You want to have a nice long career. So take care of your you take care of your back will take care of you. Don't use your back. Be smart. You'll figure out as you go along different ways of moving patients. They don't talk about some of the ways. There's what we call the hammock. You just bunch up the head and the feet, lift it up, looks just like a hammock. Then move it over. You could do GS. You obviously have the draw sheet. Arm and leg. Get it underneath their shoulder, grab a leg, lift up, bring over. So it's kind of a modified direct carry or direct lift thing. So, all right. My window's slow to react. So like I said, we will practice this, but my biggest request for you guys is that we be safe. Follow all instructions. Now, that's what I wanted, but I'm gonna show you one video and then we'll do what we have to do. I'll just use the one I've used in the past. All right, oh, fudge, I hate it when I do that.
Okay, so this next go, we're going to demo transferring a patient over from the hospital bed over to the stretcher. Whenever we're transferring a patient over using the draw sheet method, which is the most popular method, we want the piece of equipment that we're coming from to be slightly higher than the piece of equipment that we're going to. So we're going to lower the stretcher, but both pieces of equipment are going to be at the provider's waistline. No higher, no lower. Go ahead and lower it down.
Ready, and go.
That's good. A little higher than that.
Oh, ready, and up.
Yeah, that's good. That'll be fine. And then actually, I still see a lot of providers forget to put the rails down. And so we don't want the patient to get snagged on the rails. So don't forget to put the rails down with that. Make sure both pieces of equipment are equal. The head is down on both pieces of equipment. We'll have Maddie and Veery on the pulling side and Kimberly on the pushing side. When I say pushing side, she's not necessarily pushing, but she's creating a tension with the draw sheet between the pulling providers. And they're going to count all on 3. And then after that, they're going to transfer Ginny over to the stretcher. Veery or whoever is going to coach the patient to hug themselves.
All right. They just said something that I wouldn't do. So first off, you probably won't have a third person. So there's 2. Now, he said that everybody count. Well, no. In this case, I would have this girl that's by herself be the one that's counting, because she's going to have to reach over as they're moving. And look how wide this hospital gurney is. So she's going to have to make up for that. And again, she's not very tall. And this patient is not very big. So not that big of a challenge, but a little bit of a challenge. So she has to be ready. She has to grab enough sheet. And sometimes you won't have enough sheet. You're really going to have to make do with what you can grab. So the girl on the left should be the one that's actually calling out, or should be counting down. Okay.
So they're not reaching outside of the bed.
All right, on 3, ready? 1, 2, 3.
That was great, guys. And then
Let me back it up just a little bit. Look how she's still lifting, right? But look how far she's stretching. You see the problem with draw sheet? But that's still the main way we move patients, especially once we get them into the emergency room. We're getting them from the gurney. So imagine, reverse. They got to get her from our gurney to the hospital gurney. And she has to reach that far. How much is she going to be able to lift?
Not much. Not much.
Not much. So she's probably going to have to drag. And remember what I said about the ouch, that little drop or anything? So.
that was great, guys. And then go ahead and wrap Ginny, and then don't forget to put the rail.
And let me back it up just a little bit. So right here, as soon as they moved her over, you see how the rail is not up? And some patients might be moving because they felt uncomfortable. And this gurney is not as wide as this other gurney. So she could separate the ambulance gurney from the hospital gurney, and what's going to fall, or what's going to happen to that patient? They're going to fall. And so what you should do right away until she gets around is they should reach over, grab the sheet, and be holding the patient back, securing that patient until you can get that guardrail up and put the seatbelts on. So maybe one of these days, maybe a couple of you guys can help me to do a proper video on how to draw sheet a patient. Because I always find something wrong with everything I show. Sorry. I mean,
Wrap Ginny, and then don't forget to put the rail up on that side.
Do you want to sit up?
We're going to ask the patient for their position of comfort, and then as that's all happening, we're going to simultaneously start securing the patient to the stretcher and then load them up, ready to go. All right, you look comfy. Yep. Okay, so this next go, we're going to demo.
All right. So that's the draw sheet. Looks kind of easy, right? For the most part, it is. But you see the problem with that method. There's a high probability of hurting yourself because you have to break some of the proper mechanic rules, which is don't reach too much and don't use your back. So, all right. Any questions about today's topic? All right. How about